Good morning. I'm Eileen Sullivan-Marks, and I'm Dean at the New York University's Rory Myers College of Nursing. And today is one in a series of our Dean's Global Health Lecture Series. Today, we're thrilled to be able to talk about the priorities and opportunities in global health research, hearing from colleagues at the Fogarty International Center. I want to first introduce our esteemed colleagues and our moderator, Dr. Bei Wu. Dr. Bei Wu is our Dean's Global Health Professor and our Vice Dean for Research at the NYU Rory Myers College of Nursing. Dr. Wu is a social scientist, a gerontologist known for her work in promoting oral health and cognitive health among frail older adults. Our esteemed speakers today are Dr. Peter Kilmarks and Dr. Kathleen Michels. Dr. Kilmarks is an expert in global health and infectious disease research policy and programs, currently the Deputy Director of the Johnny Fogarty International Center of the National Institutes of Health. He has been chief of the CDC's Sexual Transmission Research Section in Thailand, and has had leadership roles in the CDC's Ebola response efforts in the Dominican Republic. For many years, he served for more than 20, that is, in the US Public Health Service, rising to the rank of Rear Admiral or Assistant Surgeon General, and received the Distinguished Service Medal from that organization. He began his career early on internationally as a Peace Corps volunteer in the DRC, where he helped to develop fisheries that are still there today. And I know that sustainability is always something we strive for in our international work. Dr. Kathleen Michels is a neuroscientist and currently a program officer in the Division of International Training and Research at the Fogarty International Center at the NIH. She and her team were awarded the NIH Director's Award for partnering across NIH to develop and manage pioneering catalytic programs for global brain and neurohealth research and research capacity building for low and middle income countries. Her international research training programs have focused on clinical, prevention, and implementation science research. We have posted more details of the bios of our speakers today for your reference. I also want to thank our team for the excellent work of putting this together. Carrie Stalonis, Anata Kurtz, Tom Friedman, and Ian Henley here at Myers. And to all of you, thank you for joining us today. And please spread the word and look forward to future Global Health Lecture Series from us. I turn it now over to Dr. Wu.
Thank you, Dean Eileen, for the introduction. I would like to thank our two esteemed panelists for making the time to present in this global health lecture. NIH Fogarty International Center's mission is to address global health challenges through innovative and collaborative programs for research and training. Fogarty International Center is a prime organization at NIH to fund global health research and training. In today's presentation, our panelists will give the audience a brief introduction on NIH funding opportunities in global health research and research capacity building for global health. Before we start the session, I would like to ask our audience, please feel free to type your questions in the Q&A box anytime during our panelist presentation. We will have the Q&A sessions after our panelist presentation. So now I would like to turn the floor to Dr. Kilmarks. The floor is yours. Thank you.
Thank you, Dr. Wu, and thank you, Dean Eileen. It's really a pleasure, a great pleasure for Kathy and me to be here. We're really excited about the interest from NYU about research, about global research, and about engaging nurses and nurse-led research. So I've got a PowerPoint presentation that I'll put up now. And this is just my introductory slide. So we'll be talking about NIH and Fogarty and priorities in global health research. And let me just go to the next slide and let Dr. Michaels let us hear her voice. Kathy, are you with us?
Yes, I am. So yes, thank you very much for inviting us to speak, and it's my pleasure to talk with you all about our programs today. And just up there, I just have the links to a couple of the program. There's mailboxes for non-communicable diseases and brain disorders, and then for all of our programs, the website.
Great. So just as an overview, we'll talk about NIH and global health research, and then Kathy and I will talk in more detail about Fogarty's research capacity building programs, and then we'll close just talking about some of what we see as priorities and opportunities in global health research. So I just want to start with the real basics about the NIH mission. And it's really in two parts. The first part is about the basic science. And so science in pursuit of fundamental knowledge about the nature and behavior of living systems. And then the second part is the application of that knowledge to improve health, to extend healthy life and reduce illness and disability. So just keep in mind that NIH is first and foremost a science and research agency. This shows there's 27 different institutes and centers at the National Institutes of Health. The budget has been increasing year after year. It's up to now in this year, $45 billion. And you can see there's institutes that have their budgets are in the billions of dollars. The National Cancer Institute being the highest, the National Institute of Allergy and Infectious Diseases. And then you can see on the right side, we at the Fogarty International Center, our annual budget's about $87 million. And then third from the right is the National Institute for Nursing Research with a budget of about $181 million. But from Fogarty, we collaborate with and support the other institutes and centers in their global research activities. And we actually have the greatest amount of proportionately of leveraged funding of the other institutes and centers investing in and collaborating in our programs. So I'm going to make the case that it really is a global enterprise, that there's very strong support from NIH for global health research. Dr. Collins, who just recently stepped down as the NIH director, when he came on board in 2009, when he became the NIH director in 2009 and was asked about his priorities, he surprised some people in saying one of his top priorities, number 4 here, was about global health research, about expanding research into diseases affecting the developing world. And that was really borne out in his tenure. He's been a great champion for global health research, and we've really seen an increase over that time. So one might ask, why pursue global health research? Why the US, a US taxpayer-funded agency, the NIH, should pursue this? And there's a number of very compelling reasons that really get to the science mission of NIH. There's unique populations around the world. There's unique disease presentations, and especially genetics. There's much greater genetic diversity in Africa. And so there's been a number of programs to support genetic research in Africa and to build that infrastructure, and a lot that we've learned from that. The second big bullet here is about unusual exposures, environmental exposures, but also infectious diseases. I think especially are top of mind, diets and cultural context. At one point, Tom Cole, who's the appropriator congressman from Oklahoma, said he'd much rather be learning about and fighting Ebola in West Africa than in West Texas. And I think that's a well understood concept, that it's important to study these diseases, infectious diseases, but others around the world where they're more prevalent. Another is the unique interventions. There's some frugal and novel technologies, especially in mobile health, that are being developed around the world that we can learn from. There's the insights and expertise of a diverse set of investigators. The best scientists aren't all in the US, and it's important to have this collaboration. For some, especially rare diseases, it's very useful to have treatment naive patient populations around the world, so big global collaborations in that area. There's alternative health systems that we have a lot to learn from. And then I think, including those of you on this call, there's a great interest in global health among trainees and the next generation of scientists. And this is really our future workforce, and their interests, your interests should be supported. And lastly, we just need new tools to reach our global health goals. And whatever area that is, we need to have constant innovation and improvement of our interventions to achieve these goals. I just want to let you know about this online mapping tool. It's called World Report, worldreport.nih.gov. And this maps all of the grants, the directly funded grants, and also the collaborations from 14 of the major global funders of health research. So it includes the NIH, but also the Medical Research Council, the Bill and Melinda Gates Foundation, and others, the Wellcome Trust. So it's a lot of different funding organizations have their data in this database, and then it maps to over 15,000 research institutions now with over 500,000 program records. So in this example, I searched on One Health, and you can see where One Health research is being funded around the world. There's thousands of research activities going on for malaria, for example. So if you're interested in nursing research or nurses involved in research activities, you could enter that as a keyword. So I would encourage you to make use of this mapping tool to see who's doing what where to build collaborations. So if you can use World Report, and if you just limit it to the NIH funding records in fiscal year 2020, you can make a map like this that shows where the collaborations are that are being funded by the NIH, and you really get the sense of how global the NIH activities are. There's many thousands of these activities that are entered here, and actually the number one country for collaboration is Canada. And more of the collaborations are really with the higher income countries in Western Europe, but also in East Asia, South and Eastern Africa, South America. You can see around the world where a lot of the collaborations are. And you can also see where there's fewer collaborations. And in many cases, these represent opportunities for increased collaboration and more that we can learn. This shows now from that same database from World Report, the number of these foreign NIH-funded records by institute. And so it's not surprising that it's NIAID, infectious diseases, that has the most, more than twice as many as other institutes at NIH. So 5,500 of these international collaborations funded by NIAID. You can see where Fogarty is with about 800 of these collaborations, these international collaborations being funded. And that, of course, represents most of our funding, our activities from Fogarty. And you can see at the right, the National Institute for Nursing Research has a relatively small number, but it is there. There is opportunity and support for expanding that. And another key message of this slide is that this is all of the grant-making NIH institutes and centers that support global health research. So it's every institute and center that engages in these international collaborations. Okay, now shifting from looking at grants to looking at publications. With a postbac, Josh Grubbs, a few years ago, we asked the question, what percentage of NIH-funded publications has a non-US affiliated co-author? And we thought it might be 20% or so. And so we were surprised to find, if you search in PubMed and look for all publications that have NIH funding, and then look at the affiliations of the co-authors, it's 35% of those publications have a non-US affiliated co-author. So it really is a global enterprise. We also looked at the citation impact scores for the different sets of publications, and we found that those publications that have both US and non-US affiliated co-authors have a higher citation impact score than the publications that have US authors only or non-US authors only. So it really makes the case that collaboration has more impact in this one way that we look at it in terms of the scientific impact. If you look at the left at the countries where there's the greatest number of these non-US affiliations for the NIH-funded publications, surprising or maybe not surprising, China was #1, and really you can see how it increased more steeply over the years. And following China, the UK, Canada, Germany, Australia, it's the higher income countries where there's the greater collaborations in terms of this publication window. And then looking on the right side, this graph on the right side shows among the low and middle income countries other than China where the greatest collaborations are or publication record is, and that's Brazil, India, South Africa, and Mexico leading among the lower income countries. So let me turn now to Fogarty, the Fogarty International Center, and our mission is also really twofold. One is to help address the global health challenges through programs for research and training. So with our own resources, we really focus on the training and capacity building in lower income countries, low and middle income countries. And then secondly, we support all of NIH in the global partnerships, including with the higher income countries or with multilateral organizations. John Fogarty was a congressman from Rhode Island. I didn't know that until I came to Fogarty. So as a Rhode Islander myself, I was happy to have that connection with Fogarty and his great support for NIH over the years, and then especially for global health research. So we've learned at Fogarty over the years what it really takes to build science careers and support scientists in low and middle income countries. It really takes well-trained individuals. They need to have protected time to conduct their research, and they need strong mentorship from both US investigators with experience working internationally and from investigators in their low and middle income country setting. And so this schematic shows over the course of a career from undergrad to medical student or graduate student to postdoc to a career. We'll get into this more in subsequent slides, but the top part of that, it shows the research and career support awards, the career development awards. And then the general concept is that Fogarty leads in that training and capacity building. And then the bottom part of the schematic, the research awards, we have some of those, but in general, our successful trainees and grantees move on to the other institutes and centers for their research awards. The better funded, more focused on the particular scientific area institutes do the bulk of that research funding. Just to give a sense of the scope of what we do from Fogarty, there's many thousands of scientists worldwide that have received research training from Fogarty. Many of them are now in real leadership positions, including John Nkengasong at the Africa CDC, Soumya Swaminathan, who's the chief scientist at the WHO, and in many regions and countries around the world, the real leadership in health and research and the COVID-19 response in particular have been our Fogarty former trainees or grantees. And so there's currently about 400 different research and training projects being supported from Fogarty. This involves over 100 academic institutions around the world, both in the US and internationally. And I'm not going to read this whole list, but just to give a sense that we're far beyond kind of tropical medicine and infectious diseases and have a much more diverse portfolio in really all major areas of health and global health, including non-communicable diseases. Implementation science is another area that we've stressed. And then more recently at the bottom there, climate change and environmental health are really emerging priorities. So now I'm going to hand things over to Dr. Michaels. Kathy, over to you.
Thank you, Dr. Kilmarks. And so Dr. Kilmarks showed a pipeline of grants and opportunities. And so I just want to highlight that again and to to show you that we try to make sure that we have opportunities that will keep feeding into the next opportunity, from training programs for individuals to institutional training programs. Then that, I don't know if you can see my my cursor, but institutional training programs that will train low and middle income country investigators, and then finally to get them to the research grants to the stage where they are comfortable applying to those and successful. And we have been successful taking people through that pipeline, and it's really exciting. And then in the middle here, there's a career development awards. So you'll notice I have LMIC, that's low and middle income countries, and then also US. So all of these programs involve collaborations, usually between the US and low and middle income countries. But these two programs, specifically individual US scientists can apply for global health research training. So as scholars and fellows, which is a little earlier in their career, and then the career development awards allow early career US scientists who are kind of the rising stars who want to work in global health to get mentoring as well as doing research. So next slide. So I just wanted to highlight again, Dr. Kilmark's mentioned that we do have some grants programs, and R21, R03s, R01s, and U01s, and that may, if you're not familiar with the NIH system, those are developmental grants, small grants, the R21s and R03s, and then R01s are kind of the what everyone wants to get. That's the big one. And then UO1s are cooperative agreements. And so that's more collaborative. And you can see we have a number of areas that we focus on. Now, one of the key points I wanted to make here is that unlike most of NIH, we don't accept unsolicited applications. They have to be through one of our funding announcements. So applications that come into NIH unsolicited don't get assigned to Fogarty. It has to come in through one of our programs. And we use these different mechanisms I have here, but when we do, usually it's in collaboration with partner institutes. And you saw all of the different institutes that are involved. We partner with every one of those institutes with our tiny budget to be able to cover all these areas of research and then to provide research training in them. So next slide. So again, I mentioned the career development award programs, and if you are interested or know someone who might be, I encourage you to go on the website. Christine Jessup is our program officer who runs those programs, and they cover, again, every area of research that you can think of that's relevant to low and middle income countries, which is pretty much everything. The KO1s are for US citizens or permanent residents, and they provide 3 to 5 years of mentored research and career development. And the K43s, the Emerging Global Leaders Award, are low and middle income country investigators, and same, provides the same level of support. And I won't go into the rest of it in interest of time, but definitely, if you know anyone early in their career who meets the criteria, these are great programs. And many of these grantees go on to R01, go on to the full NIH awards. Not only that, and this is another point I want to make, they actually, several of these have also gone back and developed research training programs, which I'll talk about next. So research training opportunities. And so Fogarty has a mechanism we call the D43s, which most of the rest of NIH doesn't use. They're institutional research training grants. And so we award these training grants in, for example, we have a funding announcement for HIV, global infectious diseases, non-communicable diseases, bioethics, environmental and occupational health, and trauma and injury. Those are our major areas, but we sometimes issue funding announcements for these programs in other areas as well. The trainees who are in low and middle income countries would apply to one of these programs. The awards are issued to US and LMIC country institutions who are collaborating together for the research training program in that country. And we do have LMIC institutions who lead as well. So the leadership can come from the foreign country or from the US. Next slide. This is pretty much what I just said about the programs. There's the link on the bottom. This is an example of one of the programs, the Non-Communicable Diseases Across the Lifespan. That's one of the programs that I run. It's been highly successful in a variety of iterations and really getting more attention and more capacity, sustainably strengthening the research capacity of the individuals, the LMIC institutions themselves, as well as the countries, so that they are able to identify and implement evidence-based interventions that are relevant to their countries. Slide. And then the Global Health Program for Fellows and Scholars, and Peter will give some examples from that program, but that's even earlier. So I'm kind of going backwards in the pipeline. If you've seen, starting out with the research grants, how do people get there? So this is the earliest in the pipeline that we have to fund postdoctoral and doctoral training for both US and LMIC young investigators who want to pursue a career in global health. And there's consortia that we issue awards to, and so the young investigators apply to those consortia, not directly to Fogarty. Next slide. So Peter, did you want to take over from here?
Yes, thanks, Kathy. So I just wanted to focus a little bit on nursing research. And just to introduce, this is Shannon Zank, who's the director of the National Institute of Nursing Research. And she's relatively new. She came on board in 2020, previously at the University of Illinois in Chicago, and a fellow at the UIC Institute for Health Research and Policy. And she's asserted, and she's followed up on this, that she really does have a longstanding interest in global health. In her career, she'd spent time in northern Nigeria and also helping the University of Rwanda, their nursing faculty developing their research ideas, and participated in Rwanda's first international conference on nursing in midwifery. So the trajectory is up, but NINR already is supporting dozens of research collaborations in Africa, Asia, Australia, and Europe. So we're excited to have Dr. Zank on board as a partner working with us. And just to get to some of the examples, this is one of the Fogarty Fellows that Kathy mentioned. He's leading a study investigating nurse-led delivery of HIV pre-exposure prophylaxis in Uganda. And this is working in family planning clinics where nurses care for adolescent girls and young women. And the previous model had been dispensing the pre-exposure prophylaxis in HIV clinics, whereas the PrEP is actually for people who are HIV negative. So this seemed like it would be just a more appropriate setting, and then more appropriate staffing, having the nurses who are already working with this population in terms of as familiar faces, and offering them pre-exposure prophylaxis for the young women that are at highest risk of infection to prevent HIV. This is taking place in Uganda, and it is this fellows training is being co-funded by NINR. Another area where we've been involved with research and education for nurses, we have a program called the Health Professionals Education Partnership Initiative, or HEPI. And this is training nurses, also doctors and other health professionals in Africa. It's really focused on interprofessional education. So there's a lot of the training is done with multiple different cadres together in the same training setting. This is taking place in these countries, these 8 countries in Africa. It's those that have a higher HIV burden and are lower income countries. This is following up on previous work, the Medical Education Partnership Initiative, or MEPI, and the Nursing Education Partnership Initiative, or NEPI. So those were 2 separate programs, and now they've been combined really with this emphasis on interprofessional education. The funding comes from PEPFAR, the President's Emergency Plan for AIDS Relief, and there is also NINR has been a partner in the implementation. Another related program is AFRE Health, the African Forum for Research and Education for Health. And this is an organization that's providing, that we're funding. They're Africa-based, Pan-Africa organization providing interprofessional leadership and convening to network health professional educators and researchers across Africa, and focusing on increasing the quantity, quality, and retention of African health professionals to improve health and address HIV/AIDS. This is also funded from PEPFAR. And the current, it's nice, Dr. Abigail Kazembe is the current AFRE Health president, and she's a nurse midwife in Malawi. So there's real nursing leadership for health education and research in Africa that we're able to support. Just want to mention, well, let me introduce our director, Dr. Roger Glass, who's pictured here. And just want to note that we really do emphasize equity in our international partnerships. And here's a editorial, a commentary that Dr. Glass wrote about decolonizing and democratizing global health, and really the importance of having equitable partnerships as we're supporting high-income country institutions, US institutions, in collaboration and partnership with those in low and middle income countries. So Dr. Glass and I, and just closing up with what we emphasize or see in terms of potential priorities going forward, Dr. Glass and I wrote an opinion piece published in PLOS Medicine last year. And first is just how we saw how COVID-19 provided a very strong example of the importance of capacity as an essential element of pandemic preparedness. And that we really think that what we're doing in building health research capacity is a high priority to achieve our COVID control, but also all of our shared global health goals and increasing resilience for future health threats, whether it's from new pandemics or climate or the NCD tsunami that's facing us with increasing obesity, hypertension, and diabetes around the world. And again, the second bullet is this note about equity, and how we really, with COVID-19, how we've seen some really strong expertise and leadership from lower income countries, that we really need to bring a new sense of humility and equity in our international engagements to improve global health. There's really a bidirectional learning that is going on. Some of the areas that we see as priorities, and there's some disappointment that we don't just pick one, but I think that's unrealistic. There really is a lot of very real health threats and health research opportunities that we need to emphasize. One being just the unfinished COVID-19 research agenda. We have a lot of tools now, but there's a big implementation research agenda in terms of how to implement those, such as the testing or making treatment more widely available. And then, of course, with long COVID, we have a lot to learn about that. But some of the other areas, the first sub-bullet there is about non-communicable diseases. This has really been the biggest increase in the disability-adjusted life years being lost over the past couple of decades. And so really a research priority. And then of note, there's overlapping risk factors. So treating or reducing hypertension, obesity, tobacco use, air pollution. These will help to improve a number of different health outcomes. Also note the overlap here with COVID-19 and either severe COVID-19 or long COVID-19 and that there's a lot we need to learn in terms of that. The second bullet here is about One Health and looking at the interconnections between humans, animals, plants, and the environment. This is really a transdisciplinary approach to One Health and looking at these areas of infectious diseases, antimicrobial resistance, et cetera. The next is in planetary health, and this includes climate change, but is broader than that, also including declining biodiversity, pollution, and shortages of natural resources. And then lastly, and want to emphasize again, implementation research. It's one of our priorities in our strategic plan, and we really want to close, it's called the know-do gap between what we know and what we actually do in terms of uptake and implementation of evidence-based interventions, both in healthcare, but also in policy and public health settings. So it is quite broad. I don't think it's overwhelming. It's really the message is that there's a lot of different areas where there's need for research and support from NIH for research. So just closing in summary, again, that NIH is very engaged and supportive of global health research, that Fogarty is very committed to these equitable global health partnerships and research capacity strengthening, both for careers of international as well as US scientists. And we, again, see many diverse priorities and opportunities for this kind of research. And my last slide, just want to encourage you to keep in touch with us. If you're interested in global health research, we have a funding newsletter that comes out every week, and this includes NIH funding opportunities, but also from others around the world, other institutions with funding opportunities. We include that. And then Global Health Matters, our newsletter comes out every 2 months and really has the latest news on new directions in global health research, who's who, and what's happening. We're also on social media, and you can follow us there. So I'll close the presentation and close our presentation and look forward to questions and answers from the audience. Thank you.
Thank you, Dr. Kilmax and Dr. Michaels. So we have quite a few questions coming out of the audience. So the first question I want to ask, the one audience asked a question, would it be possible to share these slides with attendees?
Yes, absolutely.
Okay, great, thank you. So, so one question is, can you talk more about the pipeline and how you see early researchers getting involved? Will it be critical to have low and middle income partners to apply for an early career grant? Specific to nursing, is there any particular focus on or area you have seen that is a priority focus?
Kathy, do you want to
Do you want me to start? So yeah, I mean, those are all good questions. I mean, I think to get involved, so if you're early in your career and you want to get involved in global health in general, seek out institutions that have global health programs, and often they will help to lead you to opportunities such as what Fogarty has. But also, now that you have familiarity with that Fogarty exists and that we have some of these programs, you can reach out to Fogarty as well. There's at NIH in general and Fogarty as well, there's program officers, and part of what we're here for, the main reason we're actually here, is to talk with and respond to and interact with the community. So one of my messages always is don't be shy, ask questions, don't be afraid, don't think you're a pest. But so that would be my two: get involved, look for a global health program, contact Fogarty, and remember that all the other institutes at NIH also do international funding. Talk to NINR. They don't do, they're small, as you saw, and they don't do a lot of international funding, but the more they hear, this is another really good point, the more any of the institutes and the NIH in general hear about a certain interest, the more likely they are to, address it. So, if you have an interest, contact the NIH and ask questions. Again, it's not a black box. You're an important part of it.
Thank you, Dr. Michael. Actually, as a follow-up question.
Can I just add to that?
Oh, yes, please.
Yeah, sure. I just wanted to add onto that a couple of thoughts for those that are earlier in their career. One is to be relatively pluripotent in terms of what your interests are. And, you may think you're very interested in the left kidney, but in fact, the best mentor is a right kidney person. And especially early on, work with the people that are going to be more supportive of your career, better mentors, and supportive of you. And I would say, engage in these meetings, the Consortium of Universities for Global Health and other meetings, and especially online, it's easy to raise your hand and ask questions or put things in chat or introduce yourself, but find out who the best mentors are, the best collaborators are, and to try to work with them. And especially working in a low and middle income country, if you just, show up in Nairobi and say, I'm going to do right kidney research, who wants to work with me? That may not be a priority for the people in Nairobi, and better to find out who are, great health researchers, policy people, implementers, and say, hey, I'm interested in global health research. What are you working on that I can support, that I can help you with? That's just much better from an equity standpoint, and much more likely to be successful if you're working, with someone that's their interest and their priority. Thanks.
Thank you, Dr. Kilmax. So as a follow-up, just think about that researchers, because each institute has some international kind of funding portfolio. So as the early stage investigators, for example, how we can help them to figure out, oh, maybe your proposal can kind of target to Fogarty, or maybe your proposal can target to NIMHD or NIA. So what are kind of strategies that you can kind of share with the audience?
So, one thing to remember is, so when you have a proposal for Fogarty, and it's not just Fogarty, any of these centers, so Fogarty is a center. There are other centers at NIH. They typically function by having funding announcements that you apply to. The rest of NIH, you can submit a proposal and you don't have to identify an institute. It will get assigned to an institute. So that's a really important point to be aware of. But in spite of that, there's one key point: contact the program staff at the institute. If you're so with a very broad institute like or a center like Fogarty, look to see who's covering the areas that you're interested in. If it's not clear, just email, call, and again, don't be shy and don't be afraid of being a pest. Everybody is really busy, so you use all the different ways of contacting them if you don't get a response right away. And what Fogarty often will do is to help if you have an interest in a certain area and you're interested globally, we can help link you up with some of the program staff at the other institutes or in that area. So that's one of the functions that we can help to serve. But if you know that you're interested in, for example, mental health, NIMH has a global mental health office. So go to their website, go to the institute websites, look and see who is, if they have an international office, who are the contacts there, and get in touch with them. That is really important. However, not all the institutes have an international office, and that's then you would go to the program staff who is listed on that website, who is covering your area of interest. And you can also contact Fogarty and say, can you help me? I'm interested in, I'm trying to think of an institute. Yeah, aging. So Astronaut Institute on Aging, they're very involved in international research actually, but and they're very collaborative with Fogarty, but they don't have an international office. So you might look, well, who do I talk to at, at NIA? If you contact Fogarty, we can help put you in touch with people who are working in the different areas of aging, who are interested in global health. So there's a variety of ways. So there's no one way, but I would contact program staff, look at the websites, use the website to find out who the points of interest, and look at the funding announcements and make sure at the end of the funding announcements, there's program contact and scientific contacts. Use those contacts.
And just to chime in, 100% agree, and to emphasize that the vast majority of NIH resources are for the extramural research community. So, it's really the NIH mission to fund and support you, researchers working at universities, not to fund ourselves or to support ourselves. And there's a great interest in the so-called pipeline of getting early career trainees involved. And especially also women in science and underrepresented minorities in science. So it's really our job to support people in pursuing their scientific interests and careers.
Thank you. So can you talk more about your interest in implementation science, the funding in implementation science?
Peter, do you want to do that first? Do you want me to do that first?
You're doing great.
So when I first started out, so I've been at Fogarty for quite a while, and we used to call it prevention science and operational research. We had all sorts of other terms. And in more recent years, implementation science has come to cover a lot of, translation, prevention, research. So in order for research and research intervention and interventions that are identified through research to have an impact, you want to be able to implement it. But how do you implement the interventions? Are they the appropriate interventions ultimately for, the broader group of people, the localities? So this is all, kind of questions that implementation science answers. And so we've been, so we include implementation science research and research training as part of all of our programs, pretty much, unless it's a specific, research, funding announcement. But so, for example, for my global brain, I run a global brain research program in collaboration with many of the other institutes in NIH, but Fogarty runs it. As one of the topics that we allow, there's basic research, translation, clinical research, translation, and implementation science, is one of the areas that we, recommend that people can focus on. For our research training programs, the non-communicable diseases one that I mentioned, we have whole research training programs that are focused specifically on implementation science. So it could either be a part of a research or research training program or the actual focus. And again, it's to really make sure that what the research outcomes that are identified actually get implemented in the real world in low and mid-income countries.
And I'll add on again, it's really striking across NIH. There's other institutes that are very engaged in implementation research and also in global implementation research. So the National Cancer Institute, mental health, heart, lung, and blood are all very engaged with us. We have several collaborations with those other institutes in implementation research. There's a big D&I, dissemination and implementation program, a conference, training institute with engagement from global health researchers. We work, another program is called the Global Alliance for Chronic Disease, where we work with other international funders of global health research, and there's a implementation science training program as part of that. So a lot of support.
Thank you. So does the Fogarty joint fund international programs with other institutions? So is this common or?
I would say it's relatively uncommon. There's a lot of collaboration and communication and kind of parallel play. So there are a few examples. H3 Africa, where the Wellcome Trust and NIH were funding, co-funding or funding together. That's human heredity and health in Africa. I mentioned the Global Alliance for Chronic Disease, where there's a number of global research institutions working together. Partly we have our own, each one has their own very specific funding guidance and regulations, and we generally don't engage in pooling funding and letting someone else make the funding decisions for us in terms of the peer review and funding awards. So that we're very aware of what each other's doing. It's part of our job to know what the landscape is and to be able to point people to other opportunities and to not duplicate activities. But it's there's a few examples, but generally not those kinds of co-funding arrangements. Kathy, do you have any other examples or anything to add?
Yeah, I mean, I think that for working without, if the question specifically was outside organizations outside of NIH, that what Dr. Kilmark's just said was, kind of covers that. We're somewhat constrained with what we can do on a funding basis. We do a lot of consultative type of collaboration, obviously, and put on, conferences and meetings. But as far as funding goes, we're somewhat limited in what we can do. And when if one of the questions is, how much collaboration do we do within NIH, a lot of that. So, as I said, we can help to identify staff within other institutes at NIH if it's not clear, to help, since all of the other institutes also fund global work.
Right. Thank you. So how can we get more involved in HAPI or NAPI and nursing education in Africa? You mentioned some of the funding opportunities there.
Sure. So it would be mainly, reaching out to looking at our website and seeing what the funded institutions are, and if you have any existing connections with them to pursue that. So some of our grant programs, only the LMIC or African institutions are eligible to apply, and that was the case for HEPI and for AFRE Health. So those awards are made. It was just one round. Actually, there was 1.5 rounds for HEPI, but there's no new NIH direct funding opportunities for anyone, and there never was for US-based institutions. So it would be more just to contact them and see if there's areas where you could collaborate or support them.
And I just want to mention opportunities specifically for nursing, since I didn't, in our research training program, the institutional research training programs, we have had over time some nursing focused programs. We had one that was specifically focused on research training for nurses, in Ethiopia. In that case, I think there was one in Cameroon. So there's an opportunity there, and beyond that, nurses or nursing staff or healthcare workers in general are able to submit through any of our programs, as it's relevant to that program, and to as individuals to get involved in any of the research training opportunities that are available. So the all ends of the spectrum, the senior investigators who want to start research training programs themselves, and the starting investigators who want to get involved. They can just plug in anywhere along the way. And again, as I said, advocate within NIH for more, let the Nursing Institute, let other institutes where research can, does, and should involve nursing that you're interested in, in the domain of cancer, for example. So there's a lot of interaction between the outside research community and the NIH to, it's not all just, we're, giving out, you all tell us what you need.
Thank you. Last question from the audience. For training grants, is there any competitive advantage for submitting in collaboration with other professional schools, for example, medicine, public health, or would this be a disadvantage for funding?
No, that's actually, we really encourage collaborations. We, in fact, we had a program at one point that it was just very difficult to run, but was highly successful, that required collaborations across an institution, particularly involving kind of non-traditional, say the business school with, the medical school with the public health, so it actually required it. And it was a really interesting program, and it actually had a lot of side benefits. Even the programs that didn't get funded, the grant applications that didn't get funded, a lot of them went on because they, this is another thing to think about, is if you're going to apply, in order to apply for that program, they had to do a lot of work to put these, potential collaborations in place. They had to talk to each other. It got them talking to each other. So that's a long answer to your question. It's definitely a benefit, particularly if it's relevant. Obviously, within a grant application, this gets to grantsmanship, you have to justify what you're doing. So you don't want to just pull in, somebody from the business school with, so why, is there a good reason? But if you can put together a application that involves multiple parts of an institution, different areas, and justify it well, I mean, that could be really a powerful application. And so
I would just add, especially if there's a part of your institution that's quite well known and global leaders in a particular area, and say now we're going to harness that and engage them in this global health research activity, that can be a strong combination. But important as part of that to have a clear, what's the governance and decision-making process within this collaboration.
Right.
Yeah, I know time is up. Thank you so much, Dr. Kilmarks and Dr. Michaels, for your wonderful presentation. This is very informative. I hope that certainly your presentation can help us to promote more global health research and training activities at our college and at NYU as well. So I would also like to thank our audience for attending this session. Thank you very much.
Thank you. Great pleasure to meet and speak with all of you.
Yeah, thank you very much. And it was a pleasure, Dr. Wu, to see you again.
Thank you very much so. Very nice seeing you. Thank you.
Take care.